Hello, and welcome to Wellness After 50. If you're looking to stay healthy, vibrant, and informed as you age, you're in the right place. Today, we're talking about a crucial health topic that could save lives. 8 silent signs of developing cancer you shouldn't ignore, and make sure to watch till the end. Some of these signs might surprise you. Now, let's get started. The first sign: unexplained weight loss. Unexplained weight loss can be one of the most alarming signs your body is giving you. While many people might think of weight loss as a positive thing, a sudden drop of 10 pounds or more without any effort, such as changes in diet, exercise, or lifestyle, could be a red flag for serious health issues, including cancer. Weight loss can occur for several reasons when cancer is present. For some cancers, such as those of the pancreas, stomach, esophagus, or lungs, the tumor can disrupt normal metabolism and digestion, leading to malabsorption of nutrients. This means your body may not be absorbing enough calories from food, even though you're eating regularly. In other cases, the body might start using more energy than usual due to the increased metabolic demands of cancer cells. Cancers can also release specific chemicals known as cytokines, which can cause inflammation and alter the way your body processes fat and protein. This can lead to muscle wasting, known as cachexia, and further weight loss. For example, cancers of the digestive system can interfere with nutrient absorption, and cancers that spread to the liver can affect your body's ability to store and metabolize nutrients. While a sudden drop in weight is often associated with advanced stages of cancer, it can also occur in the earlier stages. Therefore, it's essential to be aware of unexplained weight loss, especially if it's accompanied by other symptoms like fatigue, weakness, loss of appetite, or pain. If you notice any unexplained weight loss that isn't linked to changes in your routine, diet, or physical activity, it's important to consult a doctor as soon as possible. Early detection and intervention are key to improving outcomes for many cancers, so don't wait for other symptoms to appear. The second sign: persistent fatigue. Persistent fatigue is another silent warning sign that can often be linked to developing cancer. We all experience tiredness from time to time, especially during periods of stress or after physical exertion. However, when fatigue becomes overwhelming and doesn't improve with rest, it could be a symptom of something more serious. Unlike typical tiredness, cancer-related fatigue doesn't go away with a good night's sleep or a weekend of relaxation. This type of fatigue is constant, and it can make even the simplest tasks feel exhausting. It's a feeling of weakness, lack of energy, or being run down that persists for weeks or months. Fatigue can be caused by a number of factors related to cancer. For example, the body is using a lot of energy to fight off cancer cells, which can leave you feeling drained. Cancers such as leukemia, lymphoma, and colon cancer often cause fatigue as they disrupt the body's ability to produce healthy blood cells or function normally. In addition, if the cancer is causing pain or discomfort, this can further contribute to the exhaustion. In some cases, the body's immune system is in overdrive due to the presence of cancer, leading to inflammation and a constant state of fatigue. Treatments for cancer, such as chemotherapy or radiation, can also contribute to fatigue. But it's important to note that even before a diagnosis, this kind of fatigue can appear. If you find yourself feeling unusually tired, to the point where it affects your daily life, and it doesn't improve with rest, it's important to seek medical attention. Persistent fatigue especially when accompanied by other symptoms like unexplained weight loss or pain, could indicate a serious underlying health issue, such as cancer. The third sign, changes in skin appearance. Changes in your skin, especially the appearance of new growths or alterations to existing ones, can be a subtle yet important sign of developing cancer. While some skin changes are harmless, others can be early indicators of skin cancer, or even internal cancers that affect the skin indirectly. One of the most common signs of skin cancer is the appearance of new moles, growths, or changes in existing moles. Skin cancers like melanoma, basal cell carcinoma, and squamous cell carcinoma can cause moles to change in size, shape, or color. For example, a mole that becomes asymmetrical, has uneven borders, or changes in color, becoming darker or more than one color, should raise concerns. If the mole becomes itchy, bleeds, or starts to grow rapidly, it could be a sign of melanoma, which is the deadliest form of skin cancer. But changes in skin appearance aren't limited to moles. Unexplained patches of darkened skin, redness, or the development of open sores that don't heal could also be signs of internal cancers, such as those in the breast, stomach, or pancreas. For instance, certain cancers can affect the liver, which may cause a yellowing of the skin and eyes, known as jaundice. This is often a result of the liver being compromised by cancer or its spread. Additionally, unexplained bruising or bleeding under the skin, especially without an obvious cause, could indicate leukemia or other cancers that affect the blood. If you notice your skin becoming more sensitive, developing unusual rashes, or experiencing persistent changes in texture or color, it's essential to see a doctor. Early detection of changes in the skin can make a significant difference in treatment outcomes, especially when it comes to skin cancers like melanoma. If you notice any new or unusual skin changes, don't hesitate to have them checked out by a healthcare professional. The fourth sign, persistent cough or hoarseness. A persistent cough or hoarseness that doesn't go away could be an important early warning sign of cancer, especially cancers affecting the lungs, throat, or larynx. While a cough is a common symptom of colds and respiratory infections, if it persists for more than 3 weeks or worsens over time, it could signal something more serious. A chronic cough that doesn't seem to improve could be a symptom of lung cancer, particularly if it's accompanied by other signs like shortness of breath, chest pain, or coughing up blood. Lung cancer can irritate the airways and lungs, leading to a persistent cough. Additionally, hoarseness, when your voice becomes raspy, strained, or changes in tone, could be a sign of throat or laryngeal cancer, or it might occur if cancer has spread to the vocal cords. In some cases, the persistent cough and hoarseness may be caused by cancers that affect the digestive system, such as esophageal cancer, which can press against the trachea, windpipe, and cause coughing or voice changes. The irritation from the tumor or from acid reflux that is often associated with esophageal cancer can lead to these symptoms as well. For some individuals, a persistent cough might be a sign of metastatic cancer, meaning the cancer has spread from another area of the body. Cancers that spread to the lungs or respiratory system can cause coughing, hoarseness, and difficulty breathing. If you notice a cough or voice changes that last for more than a few weeks, especially if they are associated with other symptoms like weight loss, difficulty swallowing, or pain, it's crucial to see a doctor. Early diagnosis and treatment are essential for improving outcomes, especially when dealing with cancers of the lungs or throat. The fifth sign, difficulty swallowing, dysphagia. Difficulty swallowing, also known as dysphagia, is a common but often overlooked symptom that could indicate a serious health issue, including cancer. If you find yourself frequently choking on food or liquids, feeling like food is getting stuck in your throat, or having trouble swallowing even when you're not eating, this could be a sign of an underlying condition, such as cancer in the esophagus, throat, or stomach. Esophageal cancer is one of the most common causes of dysphagia. As a tumor grows in the esophagus, it can narrow the passageway, making it difficult for food and liquids to pass through. Initially, this may just cause occasional discomfort or a sensation of something being stuck in the chest. But as the tumor grows, swallowing may become more challenging and painful. Difficulty swallowing may also occur with cancers of the throat or larynx, where the tumor affects the muscles or structures that aid in swallowing. In addition to physical blockages, difficulty swallowing can also be caused by cancers that lead to inflammation in the esophagus or throat, such as stomach or lung cancers that have spread. Other conditions like acid reflux disease or certain neurological conditions can cause similar symptoms, but if the swallowing issues are persistent or worsen over time, it's important to seek medical advice. If you experience dysphagia, along with other symptoms like weight loss, pain when swallowing, or regurgitation of food, it's crucial to consult a healthcare professional for evaluation. Early detection and treatment are vital for cancers of the digestive tract, and addressing difficulty swallowing promptly can prevent complications. The sixth sign, unexplained pain. Unexplained pain that persists for weeks or months, especially if it doesn't have an obvious cause, can be an important red flag for cancer. While occasional aches and pains are normal as we age, consistent or unexplained pain that doesn't improve with standard treatments, like over-the-counter pain relievers, should not be ignored. Pain related to cancer can occur in various ways, depending on the type and location of the tumor. For instance, bone pain can be a symptom of bone cancer or metastasis, when cancer from another part of the body spreads to the bones. Back pain can sometimes signal cancers of the pancreas, ovaries, or kidneys, while abdominal pain may be linked to gastrointestinal cancers, such as those in the stomach, liver, or intestines. In many cases, cancer-related pain is caused by the tumor pressing against nearby organs, tissues, or nerves. As tumors grow, they can put pressure on sensitive areas, leading to persistent or sharp pain. For example, pancreatic cancer often causes pain in the upper abdomen or back, while lung cancer may cause chest pain or discomfort that worsens with breathing or coughing. Some cancers, like those affecting the brain or nervous system, can also cause headaches, migraines, or unexplained neurological pain. Additionally, pain that worsens at night becomes more intense with movement, or changes in nature over time could indicate cancer, especially when it's coupled with other symptoms like unexplained weight loss, fatigue, or swelling. If you experience persistent pain that doesn't respond to treatment, or pain that is unusual for you, it's important to consult with a healthcare provider to determine the underlying cause. Early diagnosis and treatment are essential for improving outcomes, particularly for cancers that can be more difficult to detect in the early stages. The seventh sign, changes in bowel or bladder habits. Changes in bowel or bladder habits can be a subtle but significant sign of developing cancer. particularly cancers of the digestive or urinary systems. If you notice sudden and unexplained changes in your bathroom routine, such as persistent constipation, diarrhea, blood in your stool, or frequent urination, it could be an indication of an underlying health issue that requires medical attention. For example, colon cancer often causes changes in bowel habits, such as persistent constipation, diarrhea, or a feeling of incomplete evacuation. Blood in the stool, whether visible or hidden, can also be a red flag for colorectal cancer. In some cases, patients may notice a change in the size or shape of their stools, such as narrow or ribbon-like stools, which could indicate a blockage or narrowing of the colon caused by a tumor. Bladder cancer can also cause changes in urinary habits. A common symptom is frequent urination, especially during the night, or the sudden, urgent need to urinate even when the bladder isn't full. Blood in the urine, also known as hematuria, is another alarming sign of bladder cancer. While urinary issues can sometimes be caused by less serious conditions like urinary tract infections or benign prostate problems, blood in the urine or painful urination should always be checked by a doctor. Changes in bowel and bladder habits can also be a sign of kidney cancer, particularly if you experience pain in the back or side, blood in your urine, or unexplained weight loss alongside urinary changes. If you experience any persistent or unusual changes in your bowel or bladder habits, it's important to seek medical advice. Early detection of cancers like colon, bladder, or kidney cancer can lead to better treatment outcomes. So don't ignore these symptoms, especially if they continue over time. The eighth sign, unexplained bleeding or bruising. Unexplained bleeding or bruising that occurs without an obvious cause can be a concerning sign of cancer, especially blood cancers like leukemia or cancers that affect the blood vessels. If you notice bruising easily or bleeding from unusual areas such as your gums, nose, or urinary tract, and there is no clear explanation, it's important to have it evaluated by a healthcare provider. Leukemia, a type of blood cancer, often causes excessive bruising, as well as prolonged or unexplained bleeding. This happens because leukemia affects the production of platelets in the blood, which are responsible for clotting. Without enough platelets, minor injuries can lead to large bruises, and bleeding can continue longer than usual. People with leukemia may also experience frequent nosebleeds, bleeding gums, or tiny red spots on the skin called petechiae, which are caused by tiny blood vessels breaking under the skin. Similarly, liver cancer can cause abnormal bleeding due to its effect on blood clotting proteins. If the liver is damaged by cancer, it may not produce enough clotting factors, leading to easy bruising or excessive bleeding from small cuts or injuries. In some cases, bleeding can also be a sign of pancreatic cancer, especially if it's associated with a drop in blood platelet count. Unexplained vaginal bleeding can also be a sign of uterine or cervical cancer, and rectal bleeding might indicate rectal or colon cancer. These signs should not be ignored, as early intervention can make a big difference in outcomes. If you notice any unusual or persistent bleeding or bruising, especially if it's frequent or severe, don't wait to seek medical attention. A healthcare provider can run tests, determine the cause, and provide the necessary treatment. It's important to remember that these 8 silent signs are not always a guarantee of cancer, but they should never be ignored. Early detection is key to improving treatment outcomes and increasing the chances of recovery. If you notice any of these symptoms, unexplained weight loss, persistent fatigue, changes in your skin, a persistent cough, difficulty swallowing, unexplained pain, changes in bowel or bladder habits, or unexplained bleeding, don't hesitate to consult a healthcare professional. Your health is your most valuable asset, and taking action early can make all the difference. Thank you for watching today's video on Wellness After 50. If you found this information helpful, please give it a thumbs up, share it with someone who might benefit, and don't forget to subscribe for more health tips and advice to live a long, healthy life. Take care of yourself, and I'll see you in the next video.